歡迎大家嚟到。
Welcome to the press briefing. With us today are Dr. Chuang Shuk-kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Linda Yu, Chief Manager, Clinical Effectiveness and Technology Management from the Hospital Authority. Dr. Chuang, please. We had 19 newly confirmed cases last night, case number 10513 to 10531. The cases consist of 9 females and 10 males aged 14 to 72, and 7 were found through the community testing centers, and there are some 20 preliminary positive cases. Today, there were no imported cases. 7 cases were untraceable, and 12 cases were linked to prior cases. These include a close contact of an individual involved in the airport third runway project worksite, and one is a staff member of the Namshan elderly home. And at that facility, there is another preliminary positive case who was confirmed after being admitted to the Asia World Expo facility. And yesterday. Since yesterday, a staff member from Uniqlo in Mongkok has tested positive. So altogether, there are 4 staff members from that shop, and we have a total of 9 linked cases. Of the cases today, there was 1 death, and that is 10531, and the patient lives in Posheng Chun of Shangshui. His family member was a confirmed case, and for that case, a test was carried out on the 21st of January, and the result was positive on the 22nd, and on the 16th, the 2 family members met, and the patient was not within the infectious period at that time, and he did not indicate that to us that he met that family member. And on the 26th or 27th, the individual who passed away visited the Shek Wu Hui outpatient clinic. In a moment, Linda would furnish the details. The patient submitted a saliva specimen bottle, but since there was leakage in the bottle, and the person had to be retested. And on the 28th, his family could not locate him, and they called the police on the 29th, and they broke into the unit, and subsequently the person was found dead. And upon testing at the mortuary, the result tested positive. We had another case who is a nurse working in a clinic, and she works on the 16th floor of a commercial building. That's the Shengqi building on 122nd Queens Road Central. The person last reported to work on the 29th when she reported a sore throat, and the patient talked to other staff members on the same floor and dined together, and as a result 5 individuals were sent to quarantine, and businesses on the 16th floor were asked to suspend operation for 14 days, and the individuals were urged to be tested. And there were untraceable local cases or buildings who saw a second case. They were to be tested. The first, Manhua Court, 647 to 651 Shanghai Street, they saw a second case. There was an earlier case at the building, and it was an untraceable one. The second building is 9 to 15 Tong Choi Street and 23rd Soy Street. and these involved 2 different units. For the other buildings, only a single unit was involved. That is Fu Yip building on 21st to 27th Station Lane. There were 2 individuals in the same unit, and Lei 1 Court Block 1 of 23rd to 33rd Haven Street in Causeway Bay, Cabo Mansion 325 to 329 Queens Road Central in Sheung-Wan. There was a single case from 1 unit, and we also had Skyscraper on Tin Hau Temple Road in North Point. There were 2 cases from a single unit. Matron Court, Block 21, Phase 3 of South Horizons, 1 case from 1 unit, and these buildings would be subject to mandatory testing. Today, no new workplaces are subject to compulsory testing. Dr. Linda Yu, please. Good afternoon. As of 9 a.m., over the past 24 hours, the HA system recorded 35 cases, and over the past 24 hours, 2 patients passed away in public hospitals. Altogether, 179 patients passed away in public hospitals. Over the past 24 hours, another 84 confirmed patients recovered and were discharged. Altogether, 9,632 patients recovered and were discharged. 664 patients are staying in 23 hospitals and the Asia World Expo Community Facility, of which 28 were in critical condition, 29 in serious condition, and 607 and were in stable condition. 1,231 negative pressure beds are in use, occupancy 60%. 672 negative pressure rooms are in use, occupancy 69.3%, and a few matters to report. First of all, at Port Oil Hospital, a 70-year-old male patient were admitted to the A&E ward of Port Oil Hospital because of chest pain. He had no other symptoms of infection, and he was admitted to the geriatric ward, and upon screening, the patient tested positive for COVID-19. The infection control team of the hospital launched investigations immediately. 6 other male patients in the same cubicle of the ward were classified as close contacts, and they would be put under quarantine for 14 days. And the patient vomited in the ward, and at that time there were 2 female nurses and 1 male nurse who attended to the patient, and the 3 nurses were classified as close contacts and would be quarantined for 14 days. When a doctor performed a check for the patient, the doctor had to pull down the patient's mask temporarily, and the doctor was classified as a contact and would be put under medical surveillance for 28 days. And the incident showed that admission screening could help identify asymptomatic COVID patients. The patient was transferred to the isolation ward of Tin Mun Hospital, and he is in stable condition. Meanwhile, at Tin Shui Wai Hospital, a service operation assistant performed cleaning operation in a tier 2 ward washroom. He had a gown and N95 respirator, but not a face shield, and the staff member would be put under surveillance, and we urge staff members to wear face shields. For the 66-year-old patient we mentioned on the 26th of January, because of coughing, and he sought medical attention at a Jockey Club outpatient clinic, and as such a deep throat saliva sample was collected, and when the patient returned the sample on the 2nd day, the New Territories microbiology lab said that there was leakage in the bottle and a retest was needed. and as such, the patient was directed to collect a fresh specimen bottle, and on the 28th of January, the patient did not collect the specimen bottle as scheduled, and he could not be reached by phone. And on the 29th of January, the police told the clinic that they found the patient dead at his residence, and the infection control unit of North Hospital was told by DH that the patient tested positive for COVID-19. And the patient had his mask on at all times, and no high-risk procedures were performed in the hospital or in the clinic. The clinic staff involved had appropriate personal protective equipment, and no close contacts were involved, and the risks were not deemed high. Thank you.
Yeah.
Question time. Please identify the company you represent. The first question, please, the lady at the back. I'm from Now TV. In Jordan, the specified restricted area, was there one uncertain case? I'd like to ask about more details of the case. Why is it that it was an indeterminate case for such a long time? And also 10531, case 10531, the patient was found dead at home. Did he have any chronic diseases, or do you think that he deteriorated very rapidly, that's why he passed away at home? Is that the case? And also, since today there is, I'd like to ask if there is any new cases from the third runway cluster. And is it necessary for all the construction sites or the workers working in the construction sites to go through mandatory testing? Because like today we have a close contact who has been confirmed. So do you think it is necessary to have a mandatory testing for all the workers in the construction? For the indeterminate case, he lived in Jordan, Chunlok Street, 22 to 28. Chunlok Street, 18 years old, male. His CT value is very high, but this is an indeterminate case, so we treat it as a not a negative case. So we would like him to stay in the hospital so that we can collect more sample to see if he would be tested positive. Well, if he is tested negative, then we would ask him to stay for a bit longer and then to collect his samples again. For 10531, according to his family members, he had some coughing during middle of December. But then we don't know further details. The last time he consulted the doctor was in Shek Wu Hui, the outpatient clinic there. So it could be possible that he had some mild symptoms before that, but he didn't go to see the doctor promptly. So of course, I don't know whether he had any chronic diseases before he passed away. So we will have to see or wait for the postmortem report. For new cases in the third runway, they are all in the quarantine centers. So we can't say that the third runway construction sites are having a outbreak. For workers on construction sites, of course, we think that they are high risk, so we have arranged for them to go through testing. As regards whether it should be mandatory, I think we have to wait and see what the other government departments think. And next question, lady at the back. I'm from Hong Kong 01. Regarding 10531, on the 16th of January, he met a family member who was a confirmed case. I'd like to know, did they dine together, or did they have any activities while they're not wearing masks? And also, what are the CT value of the family member? After he was found dead at home, is it confirmed that he died of COVID-19? And for the assisting nurse assistant, did any members of the public who visited the clinic had to go through testing? Were they regarded as close contacts? And also, regarding the sealed-off areas, I'd like to ask Dr. Zhang whether the government should provide reasons for sealing off the district, because there are some citizens who had already gone through testing, and because they live in those areas, they have to go through the testing once again. And number 3, about the screening for workers in the construction sites. Some experts mentioned that there should be more testing for construction site workers, and perhaps that they should go through testing every week. So I'd like to ask Dr. Cheung, do you think this is a feasible approach? Regarding case 10531, we don't have any detailed information regarding what the 2 family members had done on the 16th of January. We understand that the CT value of the family member was 29 on the 21st of January. Regarding the sealed-off area and districts, I don't have further details. For construction workers, yes, they are high-risk group. We recommend regular testing for this group of people. The nurse assistant and central, there are 5 persons who have been regarded as close contacts, and together, and also the clinic on the 16th floor has to suspend service for cleansing. And also patients who have come into contact or who have visited the clinic, we would recommend them to go through testing. Next question, please. The person in white on the left. I'm from cable TV. Regarding the case in the Jordan restricted area, there was 1 case identified. I'd like to ask where the person lives, on which floor, and the unit number. For case 10531, it was mentioned that there was some leakage in his sample bottle. Why is it? Well, usually they people have to wait till the result is out. Then depending on the result, they would be either be admitted into the hospital or released from the hospital. Why is it that he had to go back to the ward without waiting for the testing result? And also there are 3 confirmed cases who had visited Langham Place. Are you worried that the Uniqlo cluster, there would be an outbreak there? Will there be any arrangements for people working in Uniqlo in the workplace if there are confirmed cases?
For the individual in Jordan who was an indeterminate case, the person lived in 22 to 28 Chung Lok Street, and I would not disclose the floor and unit number. For confirmed patients, we would include the details of the whereabouts in the during the infectious period on the list. And this is a very long list, and many people in Hong Kong would visit malls such as Langham Place but it does not necessarily mean that there was an outbreak at Uniqlo. For case 10531, he resided in a village house so it was a duplex style house, and there were family members who visited both sides of the unit, so that could be a linked case. But since there were cases from both units of the village house and one of the patients passed away already, so we are getting in touch with individuals from the other units of the house, and they were sent to quarantine as close contacts. Were you referring to the patient at Port Oi Hospital? We would perform testing on many patients who were admitted, and they would not be sent or transferred to the wards only after test results were available. Next question, please. I'm from Ming Pao. For 10531 who passed away, what was his CT value, and in which part of his body was virus found? And can you tell us the case number of his family member who tested positive? And in terms of Langham Place, over the past 14 days, 14 confirmed patients had visited Langham Place. How many of them worked there, and how many were visitors? And for the premises involved, how many were offices and how many were shops? And were there any links between the cases? We received complaints that Unit 1308 at Princess building was a headhunter, and the person involved were involved in interviews. And so far, how many people tested positive? And are you going to trace the relevant staff? For 10309, the patient visited Princess Building on the 19th of January. Were they both members of the staff? At Princess Building, there was a workplace with confirmed patients, and all the individuals there were sent to quarantine, and they tested positive, so it was an office outbreak. In terms of the case number of the family member of the case patient, I don't think it is really important, so I would not disclose it.
我個記錄就係18咯。
18. That's the CT value according to my records. I don't quite remember whether there were staff members or cleaners there. It was possible, but there was no outbreak, with the exception of Uniqlo. As for the other individuals, they were typically shoppers, and the situation was the same as other shopping malls. Next question, please.
We've seen the number of cases have gone down in the past few days, and today's figure is below 20. So how would you evaluate the overall virus situation? Do you think that is now under control already? And also, with the unclear case in the Jordan lockdown, can you tell us a little bit more about why the case has been classified as unclear? And also, there has been no cases found in the recent lockdowns. Do you think that overall speaking, such measures are not very effective in identifying coronavirus cases? when, community testing has also found 7 cases today? And also about the dead patient, do you think that treatment for him has been delayed because of the leaking bottle? And also, do you think there has been any lapse in contact tracing because authorities didn't know that he previously met a confirmed patient? Thank you.
Although the number is only 19 today, but there are still 7 unlinked cases in the territory, and in the cases, and they live in various districts in the territory. So each case can become can spread to other cases. So they are also sources of infection. So I don't think the current situation is completely under control. And for the indeterminate case, every now and then we receive lab result like this because maybe the CT value is very high, so the viral load is very low, or after repeated checking, some of them will become confirmed cases and some others will become negative. And this do happen. Yeah. And for those lockdown, I think it's an enforcement measure to make sure all those residents have complied to the orders. So, of course, if we can find cases, we can stop the spread. If we cannot find any cases, then it means that there may be no cases in that block or that place. I won't speculate the cause of death for the 10531. Yeah, we may need to have the pathology report if there is any.
多一條英文問題啊，呢位老師。
Another question in English, please. The lady over here.
From the South China Morning Post, Dr. Chuang, most of the restriction testing declarations or so-called lockdowns have been issued in poor, run-down areas, which have yielded minimal number of new cases. Would it be more beneficial to turn to other districts, perhaps even upper-class districts, to do these sort of lockdowns? And can you give us a distribution of the untraceable cases today by district and the profession that they work in? And what sort of follow-up actions will be taken on the number of people who didn't answer the doors during these restriction testing declarations? Thank you.
I have no further information on those restriction declarations. For the local unlinked cases, there are 7. So some of them are housewife and insurance agent, and working in clinic, as I just mentioned, and also a part-time a staff of the elderly home confirmed today. And no, sorry, she's not the unlinked case. A kitchen worker, a security guard, Filipino domestic helper, student, that's all. And they live in various districts, and most of them have been included in the compulsory testing notice. So live in 紅磡富業大廈, Causeway Bay 禮雲大廈, 文華閣, and the other one live in Reclamation Street, but is already included in the compulsory testing, and 嘉寶大廈, and 摩天大廈, and also the 海怡半島, 美俊閣, and yeah, that's all.
下一條。
Next question. The person in gray. I'm from Oriental Daily. For the confirmed case from Uniqlo, what is the case number? In the past 3 days, the case numbers have dropped to below 30. Does Dr. Chung think that the situation is under control, and what is your view on the trend or development in the coming days or weeks? And for the lockdown areas, sometimes there's 0 case found, and sometimes only 1 or 2. So do you think that this is effective? For some buildings, for instance, in Tin Hang Estate, Hang Lok House, it is already within the area of compulsory testing zone. So do you think that there is a redundancy and there's an overlapping of resources when the lockdown is conducted again? And also the Education Bureau would like to have no more than 1/3 of the students returning to school. However, there are still a lot of buildings that are within a restricted zone. What happens if some students live in those restricted zones, and then the students cannot have the testing report yet? So do you think that they should still attend school? The DSE will start in April. If the students cannot obtain this kind of testing results, do you think they could still sit for the exam? For the intermediate case in Uniqlo, today it becomes a confirmed case. So there are altogether 4 cases in Uniqlo. We will not disclose their respective case number. Today we have 19 cases, but among them 7 are with an identified source. So for every case, there might be a transmission chain, and it is possible that that one patient may infect many others. So that's why we are still stepping up with measures to try to stamp the spread of the virus. So we cannot say that the situation is completely under control at this stage. For the lockdown principles, I believe that, yes, the government has different considerations, and I will not comment on that. And for the Education Bureau, I believe that the cases you mentioned will be thoroughly considered by the Education Bureau, and if needed, they would consult our views. The next question, please. The gentleman at the back. I'm from AM 730. For the person who passed away, when did he meet the family member? Why is it that the family member was still regarded as a connected case? Because when they met, it was not during the incubation period. And also for the person working in addition to Mong Kok, did he go to any other places? And also together with the close contacts, how many affected cases are there altogether? And for the assistant nurse, what is her case number, and what sort of work does she perform in the clinic? And as you mentioned, there was one indeterminate case who was a student. I'd like to know whether the student had attended school recently. Case 10531. Well, I didn't know which mortuary was the body sent to. Well, the family member who had met him did not tell us that he had met with case 10531 on the 16th of January. We only got to know about it afterwards. The connected case went to get the sample on the 21st. At that time, it wasn't during the incubation period, so we still have to study who infected who, because for case 10531, his family member mentioned that he had some mild symptoms already in the middle of January. And so before he consulted the doctor, he already had some mild symptom. As regards the clinic assistant, the case number is 10522. As regards the student, the last time the student went to attended school was December last year. For the clinic assistant, she worked as the front desk receptionist should have to get the body temperature of patients. In terms of Uniqlo, there are altogether 4 cases, and also 2 persons who had contacted the confirmed cases. Yes, they worked in other shops as well. We would send those who had been in close contact with these persons to the quarantine center. Next question. I'm from Apple Daily. The number of confirmed cases is gradually dropping. So, do you think that the situation is under control and it is receding? And do you think that for a Chinese New Year, the measures, the current measures could be loosen up a little bit? And also for the lockdown and mandatory testing, is it still necessary because the confirmed cases are dropping? As a doctor, from the doctor's perspective, do you think it is all right to break into citizens' flats if they refuse to open the doors? How could you continue to have confidence of the people in the government if the government is going to do that? And also for the confirmed case, you mentioned that he actually lived in a building in which the sewage sample was the virus was found in the sewage sample in that building. Well, how many other cases are found in this way in the same building? And as we understand that even for recovered patient, they might still carry virus. So how are you going to solve this problem if they have recovered and they have been released from the hospital, but then the person may still carry the virus? And also about the 18-year-old student. Further information, please. Yes, from the number of confirmed cases, it looks like that the number is dropping. Of course, this is only 1 or 2 days. Of course, we hope that it will continue to drop. However, we should not. We should still keep up with our surveillance, and then we should not slacken our measures. And for the testing of the sewage sample, this is an assisting measures. And if this sewage sample is found to carry virus, of course, the relevant department will ask if there would be any confirmed cases living in those buildings. That is an indeterminate case. Next question, please. I'm from Hong Kong Radio Hong Kong. The registration nurse in Shangqi, in Virtuous Medical Tower, I'd like to ask if she had dined with some other friends who work in the same building. So the entire tower is now, all the services have been suspended. The entire tower is going through cleansing. Well, the number of confirmed cases is dropping recently. There are people working in the restaurant and the catering industry are asking for a relaxation of the measures. I'd like to ask Dr. Cheung, do you think it is an appropriate time to relax those measures?
其他樓層嗰啲係同佢一齊食。
For the other floors, for individuals who chat with them or dine with them, they would be sent to a quarantine center, and they would know of their results very soon. If there were any positive cases, we would expand the scope of the testing. In terms of relaxation of restrictions for the premises from a public health perspective, any such move might lead to a rebound in cases. Any other questions? If not,